And third, you've heard the previous speakers tonight talk about the enormous challenge, 2.5 billion people who still need access to sanitation. Our program is located in 25 countries, and it's very small. And what's really lacking here is the ability to scale up. If we work with one city, even though Dhaka is a very large city with a significant population, how do we replicate the good models? How do we share experience and knowledge across countries so that the decision makers in the countries can make informed decisions about what works? Clearly, what works in Indonesia is not going to work in India, and what works in India is not going to work in Rwanda. So the third and most important area for our focus is on knowledge and innovation and sharing knowledge. And it could range from knowledge that would focus the decision makers on the need for water and sanitation. Last year, WSP published a 4-country study on the economics of sanitation. Now, we all know that one of the major causes of, one of the major impacts of sanitation and poor hygiene is really loss to health. But by doing an economic analysis comprehensively in the country, we actually identified that these 4 countries in Asia, Philippines, Vietnam, Cambodia, and the Philippines, lost about $9 billion a year on causes related to poor sanitation. And suddenly when the Cambodian Minister of Finance realized that in Cambodia that was about 7% of the GDP of the entire country, it became not an issue for the Minister of Health or the Minister of Water, but it became an issue for the entire country. And then he was the advocate for making sure that the country would have improved water and sanitation, the policies, and the investment design. So there's knowledge sharing really to inform decision makers at a very high level, complex level. But we also do knowledge sharing at a very simple level. In Cambodia, we recently finished a study on ceramic water filters. A ceramic water filter costs about $8, and it lasts for about 2 years. And based on this study, which took about a year, and it was done in partnership with UNICEF, WHO, and the University of North Carolina, it was determined that really this water filter had almost the identical high level of cleaning, purifying the water as boiling water, which we always thought was the best way to clean water. But for the average Cambodian family, they had the choice of purchasing this water filter for $8 and it lasting for 2 years, or purchasing firewood. And the equivalent cost of purchasing firewood for this average Cambodian family would have been about $40 for the same time period. So by doing this analysis and sharing this information, we're able to give the government of Cambodia and other governments some information to make some informed decisions about what would be the most low-cost and effective way to provide water and sanitation to its citizens. The important part of that study is not that the ceramic water filter is the best product out there, but as it turns out, there are many low-cost technologies that are very effective. But most of the research to these low-cost technologies are done by the inventors. And therefore, they're seen sometimes as biased because the inventor is coming with a study that proves that this product is very good. So in the partnership that we had with UNICEF and WHO, what we wanted to do was to try and provide some independent verification that there are effective low-cost technologies that can be used to provide improved water and sanitation to the world. Now, in closing, what I wanted, I was very pleased to be invited to be here today because, as I mentioned, AusAid has been a member of our council and a very important member. And while WSP is in 25 countries and we operate really at the global knowledge sharing level, we only have about 130 staff. And the AusAid's impact and the Australian government's impact on our program has been really to help us make choices that we would like to be able to work in every country and to really support all the citizens in the world to provide for increased access to water and sanitation, but it's not possible. Therefore, where's the most effective use of the aid money to share knowledge and to have improved effective design? Now, AusAid's impact and the Australian government's impact on WSP has not been just through the WSP program funding. Last year, we hosted an Australian youth volunteer in our Bangladesh office. And there we feel as though we can do knowledge sharing not at the government level, not only at the government level, but at a very personal level. Because this volunteer was able to come into our Bangladesh program and really understand at a personal level what are the challenges that are facing the Bangladesh government, and how can there be some knowledge sharing between what happens in Australia and what happens in Bangladesh. And so we're very grateful to AusAid for continuing to support us and to help us to make the right choices to increase water and sanitation to the 2.5 billion people in the world. Thank you.